like to be a veterinarian? Your general day consists of multiple things. There's lots of, generally you have scheduled appointments that you go through. These appointments can be something simple as an ear infection and something very complicated as a very sick pet. These appointments sometimes can lead you to doing procedures, like a small wound that you need to repair later in the day. So you're kind of balancing doing whatever procedure you need to do after and seeing rooms. So you're going in between the two. Generally, you have, as far as surgery goes, you'll have days scheduled specifically for surgery. So that will be all you're doing that day. A big part of being a veterinarian that I didn't really think a whole lot about when I was in school, I thought, you just see appointments, you do surgery, it's actually the callbacks. So you're always going to have charts coming back to your desk all the time with lab results, questions from clients. So between rooms and procedures, you need to be keeping up on those, so calling back owners and discussing your current cases. And along with that is, if you're not sure what's going on with the case, more research to figure out the best treatment for that animal. Some of the biggest challenges I've found with being a veterinarian, pretty much the number one is communication. Veterinary medicine is not just, I like animals, I want to work with animals, I don't like people. You have to talk to people. People have, they pay for the pet, it's their animal. So you have to be able to communicate with them what's wrong with the animal, get from them, which can be difficult. You have to be very tactful about how you go about talking to people. So that's the number one thing is make sure you have good communication skills because that will really help you out down the road. The next one is client compliance. It's great if you know how to treat an animal, but if you can't convey that to a client and get them to follow your instructions, the animal's not going to get better. So again, that goes back to communication. Obviously, having to euthanize animals, put animals to sleep is a very difficult part of the profession, but it's also one that can be beneficial to you and to the people because you're helping them out at kind of the end-of-life scenarios and talking them through that, but it also is difficult for you. A big thing about medicine in general is staying current because once you get out of school, things start changing, so you always have to be continuing your education. Some of the biggest benefits are, go back to clients, developing relationships with clients, helping them and helping their animals. You tend to be, when clients show up, they tell you all their life problems. It's not just my dog is sick, it's I have this huge card payment, my mom's sick, I have cancer. They just spill to you when they come. So you're almost part therapist, part doctor here. But it also can be very beneficial if you can help them through it and help their animal. Another great thing about veterinary medicine is it's exciting. You're never going to have a dull day. You never know what's going to come in the door sometimes. Some appointments, you could have some days where, I treat ear infections all day. But then the next day you have 3 emergencies show up that you have to manage at the same time. So it's an always changing, exciting career. Another great part about it is the challenging cases. Surgery, that's one of my favorite parts of medicine. So taking on harder cases and trying to be successful with them is very beneficial, as well as working through medical cases. So now I want to show you a few of the surgical cases I've done this last year, just so you can get an idea. So this picture's a little odd, but it's kind of like a chicken wing. But this is a cat that's on his back, and that's a cat's leg right here. And this is his armpit with this large mass here. So I talked to the client about, I'm not sure if I'm going to be able to get all this tumor out. There's not a lot of, once you take out this tumor, there's not a lot of skin left, so being able to close it after that. But she was really adamant on buying this animal more time, so this was one of those great cases that I could take on and try to help. So hopefully you're not too bored out by blood, but here's kind of the dissection of the mass at the beginning of it. And this is once the mass is removed, and you can see that there's a large hole here where the mass was. So the challenge here is closing it, so you can see it's a large incision once you get it closed, and a drain to help with drainage. But all in all, it's a successful case. The whole tumor was removed, and the cat recovered well. So this is kind of a funny looking picture as well. So this is a rabbit that's on his back. Here's his ears, his head, the trach tube for the anesthesia. And this is his neck where he has a couple abscesses. They also look a little bit about something else, but basically they're two little abscesses that had to be removed. So this became a challenge as once I got the abscess visualized, you can see here that this is the carotid artery, which was attached to that abscess. So a lot of these surgeries, you don't really know what you're getting into until you're in there. And so the challenge here was dissecting the artery off the abscess and getting it out without rupturing it. So this is the last case I wanted to show you guys. I did this one pretty recently. This is a dog's leg. This is his knee right here. And this is a large tumor on the dog's knee. So again, the challenge with this tumor was leaving enough skin to be able to close the leg after. So here's dissecting off the tumor. The tumor ended up being about 3 centimeters, so give you a little perspective there. And this is the finished product. So this one kind of shows the benefit of continuing education. I had actually read a few articles about how to close skin if you don't have enough skin to actually close. So you can see there's another incision here that I made in order to release tension. So I would close the first one and then close the second one in order to get the whole area closed. So is this the path for you guys? Important traits, I think, for you to have if you want to pursue veterinary medicine as a career is motivation. A real interest in animals and helping them and medicine in general. Drive, I believe, is the most important, and that's what got me into this path, because you're going to have failures. You're going to have parts along the way where you feel like, I am not smart enough for this. There's no way I can get through a finals week with 6 cumulative finals. I'm just not as smart as other people in my class. And you have to have the drive and motivation to not give up, to keep going and realize that this is something you can do and you want to do. And that goes, again, with accepting failure. You're going to fail. You're going to have that bad test. You just can't be like, well, that's it. I can do it. You just have to keep going. And it's 4 years. It's very difficult, so you have to keep that in mind throughout the years so that you don't give up during it. So that's why drive is so important to getting through it. Another thing about veterinary medicine is you have to remember it's a physically demanding job. So you're not going to be sitting at a desk all day. You're going to be on the floor with dogs and cats and trying to restrain crazy cats that want to attack and bite you. And you can see I got lots of scratches all over me. So it's not something that you just sit around for. So you have to be ready to be moving all day, which is something I like about the job, because you're not bored sitting at a desk. All in all, it's a very challenging career, but I find it very rewarding. So these are my border collies there. Sark and Ella. Does anybody have any questions about the career, preparing for it?